Hi, my name is Calvin Johnson. I'm on the faculty at the University of Florida in the Department of Pathobiology, and I'm an anatomic pathologist by training. And today I'd like to review some of the diseases of domestic animals that may be important in the examination process, realizing that I will not be able to cover all of them and will leave some very important diseases out. I would like to emphasize certain organ systems and aspects of pathology of those organ systems that are unique and that are current and that may well show up on the exam. So what I'll do is start off by discussing liver pathology. One of the first things to remember about liver function is that many systems throughout the body depend on a functioning liver. And these would include the skin and the brain and the clotting cascade, or the blood vessels. So a diseased liver will show up many times as central nervous system malfunction, or hemorrhage in the body, or skin disease, photosensitization. But the liver has a very vast functional reserve. It's been said that up to 2/3 of the liver can be removed and hepatic function will remain normal. The liver also has a tremendous regenerative capacity. If 2/3 of the liver is removed, the size of the liver will regenerate in a matter of weeks. So with these key features in mind, let's discuss some of the common diseases then that affect the liver. First of all, many diseases of the liver involve necrosis. And if you'll recall, the liver is divided into a lobule, which is a functional unit of the liver. And toxins, for instance, target specific areas of the hepatic lobule. And if one looks at the entire liver, we see the pattern as being a multifocal or a pinpoint pattern of injury. And this figure just illustrates that type of pattern. If you'll look at the piece of liver shown on the slide, there are small white dots which represent areas of nodular regeneration of the liver. And then in between those are reddish areas which represent areas of active necrosis. The liver, as I mentioned, has the capacity to regenerate, and it regenerates through the formation of small nodules, as shown here. In between the nodules, the liver regenerates through fibrosis. So what happens is fibrosis causes scarring. Scarring causes a contraction or a retraction of the liver parenchyma, and the resulting regenerative nodules expand out above the liver surface. This is a pattern we see in multiple forms of liver injury. Hepatitis, or inflammation of the liver, has many causes, as we will discuss in a few moments. And then neoplasia can be either metastatic, originating perhaps in the lymph nodes or in the pancreas and metastasizing to the liver, or it can originate in the liver, either as a hepatocellular carcinoma or as a bile duct carcinoma. First, let's discuss some of the most important hepatic toxins, or those agents that cause necrosis of the liver. And these toxins shown here are those that are particularly important in small animals. I'm talking mainly about dogs and cats in this case. Aflatoxin causes necrosis of the central lobular area of the liver. And aflatoxins are found in moldy feed materials, particularly corn or peanut-based dog foods. And they can cause a very severe and acute rapid form of necrosis that then heals through the process of regeneration and scarring. Copper toxicity is an important form of hepatotoxic injury, and this is thought to be mostly an inherited form of injury, in that certain breeds of dog, the Bedlington Terrier and the West Highland White Terrier, have an inherited deficiency of copper metabolism. The result is copper is accumulated in the liver to to a level that's toxic, and then that toxic level causes necrosis. There are certain drugs that are associated with hepatic necrosis. And interestingly, many of these drugs are anticonvulsants. They're used to treat dogs that are showing seizure activity. Dilantin is a good example of a drug that is used very commonly to treat seizures, and a small percentage of the dogs that are treated with this drug will develop hepatic injury. This is known as an idiosyncratic response, meaning that it's an injury that does not affect every animal that's treated with the drug, but a very small percentage. But that percentage that is affected very severely in the form of liver injury. Diazepam is a toxin that is particularly important in cats. They're very prone to toxicity and also cause hepatic necrosis. And then mebendazole. This is an anthelmintic that was at one time incorporated into heartworm preventative and is a potent hepatotoxin in a very small percentage of individual animals that take this drug. Now let's just look at a few other species and review some of the most important hepatotoxins, or those agents that cause hepatic necrosis in these animals. In cattle, the blue-green algae known as microcystis is an important cause of hepatic necrosis. The condition is known as microcystosis, and blue-green algae produces a toxin known as microcystin LR. Usually the scenario in a toxicity such as this is a cow is drinking water from a pond that is contaminated with this blue-green algae, and the toxin is ingested, and then a very small number of animals that are consuming this water then develop evidence of liver injury. And again, most of these animals would show signs such as icterus or jaundice, brain injury. They may be either depressed, comatose, or they may become hyperexcited. And then they may develop skin lesions due to photosensitization. In sheep, we know that this animal is very prone to copper toxicosis. And this is probably due to an inherited trait of sheep, where levels of copper that are normally not toxic, at least to cattle, are highly toxic to sheep. And we see this in operations where cattle are being fed, cattle and sheep are kept together, and the farmer will feed the sheep the diet that was formulated for cattle. And this results then, in some cases, in copper toxicosis. This is seen as hemolytic anemia, but also as hepatic necrosis. Swine have a condition that causes hepatic necrosis known as hepatosis dietetica. This is thought to be a vitamin E selenium deficiency, and these vitamins and also the element selenium seem to be very crucial in antioxidant status. So if selenium and vitamin E is deficient, the liver is more prone to developing oxidative injury, which causes necrosis of the liver. Horses develop a condition known as serum hepatitis, also known as Tyler's disease. This is a disorder where the horse usually has been administered some sort of drug that has been derived from horse serum. This might be a tetanus antitoxin, for instance. The result is, in a small percentage of animals that receive this treatment, they develop a very severe hepatic necrosis, hemorrhage, and if they live long enough, they develop hepatic fibrosis. There are certain toxins that are notorious in affecting multiple species. In this case, swine, horses, and cattle. And the examples that I'd like to mention are, first, pyrrolizidine alkaloid toxicosis. The common plant in this area would be crotalaria, that causes severe hepatic necrosis in farm animals. And then, just as in dogs, these farm animals will also be prone to aflatoxin exposure or aflatoxicosis. causing central lobular necrosis and then proliferation of the bile ducts, and this can cause hepatic failure. Now let's move to a different category of liver injury, and that would be hepatitis. This is inflammation of the liver. In foals, particularly those that are immunosuppressed, they are prone to an infection of the liver by the bacterium Clostridium piliformis. And you may know this by another name as Bacillus piliformis. This is one of the bacterial agents that has changed names in the past 5 years. And there are several that I'll mention during the course of this talk, and I'll try to emphasize both the old name and the new name. The name of the disease that in foals that is due to infection by this bacterium is known as Tisser's disease. It enters the body through the intestinal tract and then migrates through the portal blood into the liver. Ruminants are unique in that they are prone to hepatitis due to the release of ruminal microflora, which go through the portal blood and enter the liver. And this usually happens in cases of ruminitis, also known as grain overload or rumen acidosis. Dairy cattle that are fed a very high concentrate diet may develop ulcers in the rumen, and this is just an excellent portal of entry for bacteria and fungi to enter the portal circulation and to travel to the liver, where it causes a severe necrosis and inflammation of the liver. This is also known as sawdust liver. This would be necrosis and inflammation of the liver secondary to ruminitis. There's one virus that's very important, a very important cause of hepatitis in dogs, and that is infectious canine hepatitis. This is caused by the virus canine adenovirus type 1. It's a common component of normal canine vaccines. Its incidence has reduced very dramatically over the past 30 years, yet we still see this in dogs that have not been vaccinated, so we know that it's present in the environment. It causes two patterns of injury. We see vasculitis, which would result in hemorrhage throughout the body, particularly small hemorrhages, what we would call petechial hemorrhages, where the mucous membranes would have multiple small red areas of hemorrhage. But we also see hepatocellular necrosis. When we look at this under the microscope, we see that the hepatocytes that are dying due to this virus have intranuclear inclusion bodies, and this is pathognomonic and highly characteristic of this condition, the presence of intranuclear inclusion bodies along with hepatic necrosis, usually in a young dog that's been unvaccinated. Other lesions that are commonly associated with infectious canine hepatitis include corneal edema, which is also known as blue eye. And this is a response usually in animals that have survived the initial injury to the liver and now develop a second form of the disease in which there is edema of the cornea of the eye. One lesion that is said to be classical for infectious canine hepatitis is edema, severe edema of the gallbladder. There are several parasites of the liver that are worth noting, and particularly in Florida and in tropical environments would be Fasciola hepatica. This is the liver fluke, the fluke that lives inside the bile ducts and causes them to become fibrotic and necrotic and results in the stasis or the reduction in bile flow in the liver and eventually in fibrosis of these bile ducts. In pigs, there's a common parasitism of the liver that is due to migration of larvae of the ascarid, the swine ascarid, known as Parasparus suis. And this causes white spots in the liver that are seen usually at the time of slaughter. And these are present in the capsular surface of the liver, and they're called milk spots. And these are all secondary to larval migration of the swine ascarid. Now let's move to the respiratory system. As you know, the lung is resistant in the normal animal to inflammation and infection. And that's because it has a very efficient mucociliary apparatus. The trachea has a retrograde or a reverse movement of materials out of the lungs and into the pharynx and allows the animal to resist most infectious agents. However, whenever confounding factors occur, such as stress, overcrowding, the presence of a virus in an animal population, they become much more prone to developing pneumonia. And there are three forms of pneumonia as shown on this slide. The first is bronchopneumonia. This is a form of pneumonia that is initiated within the larger airways or the bronchi. This would be usually a bacterial agent that colonizes the bronchus and the trachea and then extends into the lung, forming a pneumonia. The second form would be an interstitial pneumonia. The difference is interstitial pneumonia targets the lining of the alveolus. And if you recall, the alveolus has the epithelial lining where air is exchanged with the blood and also contains a rich capillary supply. So any injury either to that epithelium or to the capillary will result in interstitial pneumonia. We see this usually in viral diseases that target the epithelium of the alveolus or in toxic injuries. Certain toxins are metabolized by the epithelium of the alveolus, and this serves to target the toxin to the alveolar epithelium. Finally, we have a combination of the two, known as a broncho-interstitial pattern. This is usually seen in viral infections, and the reason it's a combination of the first two is because it is not completely due to infection of a bronchus by an organism, but more it's a combination of an infection both of the bronchial epithelium and of the alveolar epithelium. So some viruses have the capacity to target both locations within the respiratory tract, the bronchus and its epithelium and the alveolus and its epithelium, and they typically cause a bronchointerstitial pneumonia. The most common pneumonia that we see in dogs would be that caused by canine distemper virus. The etiologic agent for this disease is the canine morbillivirus, known as canine distemper virus. It causes a bronchointerstitial pneumonia, and from that we should know then that the virus infects both the bronchiolar epithelium and the alveolar epithelium and causes injury to both. But what's important to remember about canine distemper virus is that it targets multiple systems of the body. When a dog is exposed to the virus, it first replicates in the lymph nodes that drain the pharynx and the airways. The virus replicates and then causes a viremia, or dissemination of the virus throughout the body. If the animal mounts an effective immune response against the virus, then the animal is immune to canine distemper. However, if the dog mounts an inefficient immune response at that early stage, then the virus replicates and disseminates throughout the body into the airways, into the brain, and there we see the classical form of this disease. Cats have two viral causes of pneumonia that are worth mentioning. And we usually realize that these are viruses that mostly target the upper respiratory tract, mainly the nasal cavity, the conjunctiva, and sometimes the trachea. But they can also extend distally into the respiratory tract, causing pneumonia. And these two viruses of cats are feline viral rhinotracheitis, which is a herpes virus, and feline calicivirus, which is a calicivirus. These two viruses are present in most feline vaccines, so again, this is a disease that is usually seen in unvaccinated animals. In addition to causing inflammation of the upper respiratory tract, feline viral rhinotracheitis can cause a bronchointerstitial pneumonia. So again, this virus has the ability to infect both the bronchial epithelium as well as the alveolar epithelium. Usually, exams that test your knowledge of these two viruses ask you one difference between these two, and that is which one of these is more likely to cause ulcers of the upper respiratory tract and of the pharynx and of the oral cavity. And the answer is feline calicivirus. This one is more likely to cause ulcers as it precedes causing pneumonia. Bacterial pneumonia is very important in small animals for one reason primarily, and that is it tends to predispose the animal to a secondary infection, usually with a virus. The agent that we see most commonly in dogs as this initiating bacterial infection would be Bordetella bronchoseptica. This bacterium is the etiologic agent for the condition known as kennel cough. And it also has the capacity to extend further down the respiratory tract and cause bronchopneumonia. It can either predispose an animal to developing a viral pneumonia, such as canine distemper, or it can complicate canine distemper pneumonia after it has already occurred. This is the reason that dogs with viral pneumonia are placed on antibiotics. There's one toxin that is particularly commonly referred to as causing interstitial pneumonia, and this toxin is a herbicide that's used. It was used at one time fairly frequently on farms, known as paraquat. Paraquat causes a very pure form of interstitial pneumonia experimentally, and we see this occasionally in animals from farms where they have accidentally ingested this herbicide. The mechanism through which this herbicide causes interstitial pneumonia is that it is consumed, it enters the bloodstream, or it's inhaled, and the type 1 alveolar epithelium located within the alveoli converts it to a more toxic form. And this more toxic form then causes the type 1 cells to die and the type 2 cells of the alveolus to proliferate. And this is one of the morphological features that I, as a histopathologist, would see in a paraquat-associated interstitial pneumonia, and that is the proliferation of the type 2 epithelial cells. Fungi cause pneumonia in small animals, and the two fungi that I'm most interested in discussing today are blastomyces and cryptococcus. These two are known as systemic fungi because they have the ability to cause systemic disease or widespread disease throughout the body in small animals. They're located in very well-defined geographic areas within the United States, namely the Mississippi River Valley and the Ohio River Valleys. This infection is endemic in these areas. And blastomycosis, which is the condition of blastomyces dermatitidis infection, usually causes a granulomatous pneumonia. It's usually a bronchopneumonia because the agent is inhaled through the airways. It can also cause granulomatous inflammation, that is, inflammation by macrophages in the liver, spleen, kidneys, eyes, and skin, and also in the reproductive tract. The most common fungal pneumonia in cats is caused by cryptococcus. This would be Cryptococcus neoformans. This agent is also present in the soil, and it has a slightly broader geographic distribution than blastomyces. We see this in cats, and it can cause nasal masses. It can extend down into the lungs and cause a fungal pneumonia as well. We see it in horses too, and it causes a similar pattern of disease as it does in cats. This photograph shows a dog lung that is affected by blastomyces dermatitidis. And I show this to emphasize the fact that the lungs are diffusely enlarged. And if you'll notice, you can usually tell when the lungs are enlarged and very firm by the fact that the imprint of the ribs is left on the lungs. And this arrow is tracing where the rib has made an imprint on the lung due to the fact that the lungs are severely swollen. This is a mycotic pneumonia, probably originated as a bronchopneumonia, but it was so severe that now it is distributed throughout the lung and caused a diffuse overall enlargement of the lung. There are some parasites of cats that are known to cause parasitic pneumonia, and the most famous of these would be toxoplasmosis, caused by the agent Toxoplasma gondii. This causes an interstitial pneumonia, which means that the agent replicates in the epithelium that lines the alveolus of the lung. There are two other parasites that we see with relatively high incidence in cats in Florida, and those are Alurostrongylis abstrusus. This is a nematode of the lung, causing a granulomatous pneumonia, and then a fluke that's present in the lung of cats, known as Paragonomus kellicotti. Both of these use a snail or a slug as an intermediate host, and that is thought to be the route of infection of cats through the consumption of these intermediate hosts. Toxoplasma pneumonia is usually seen in cats that are immunosuppressed for some reason. And I won't discuss these causes of immunosuppression in too much detail today, except there are two viruses of cats that do cause immunosuppression: feline leukemia virus and feline immunodeficiency virus. And these two viruses, after they've caused immunodeficiency, make the cat more prone to developing toxoplasma pneumonia. I'd like to discuss a little bit about the pathogenesis of the bovine respiratory disease complex. This is also called shipping fever. And the lesion that we see in these cattle is a fibrinous bronchopneumonia. So the agent is inhaled, it causes a bronchial injury, and then the pneumonia is secondary to that airway injury. There's also fibrin being released from these inflamed sites, and that is one of the features of this form of pneumonia. That's why it's preceded by the term fibrinous. Fibrin is released from blood vessels that have been injured or that have become very leaky due to inflammation, and these fibrin proteins form polymers and coagulate and form this thick mat of exudate that we see in lungs of cattle infected with this condition. The most important thing to realize about bovine respiratory disease complex is that it has multiple etiologic factors. They include a reduced host defense, and this is very broad. It could be stress, overcrowding, poor nutrition, housing with animals that are new to the environment, whatever. A second predisposing factor is a viral agent. And there are three viruses that are very important in predisposing cattle to this complex. They are parainfluenza type 3, or PI3, infectious bovine rhinotracheitis, a herpes virus known as IBR, and then bovine respiratory syncytial virus, also abbreviated BRSV. Then, after these viruses have established an infection, they make the lung more prone to bacterial infection. The two agents that we're most concerned about are Pasteurella multocida and Pasteurella hemolytica. And I'll add that Pasteurella hemolytica has very recently been renamed, and now it's known as Mannheimia hemolytica. So on an exam, you should be prepared to see either of these names, either Mannheimia hemolytica or Pasteurella hemolytica. This photograph shows the classical appearance of bovine respiratory disease complex. On the left, we have a lung that is consolidated or has this deep red discoloration on the anterior aspect. And the reason that this location is present in the anterior part of the lung is because that's the area that's closest to the larger main stem bronchi, which carry the infectious agent into the lung, causing an anterior ventral distribution, which is classical for bronchopneumonia. If we were to cut this lung and examine the cut surface, we would see what's on the right side. And this is first of all, the dark red color pattern seen in the lung parenchyma, which is the more normal area of the lung. It's very congested, meaning that it has a lot of blood pooling in the blood vessels. But also these white areas, which, if you'll look closely, they have a dark hole in the center, and this represents the lumen of the bronchus. The white area represents severe inflammation surrounding that bronchus, and that then goes along with the pathogenesis or the pattern of bronchopneumonia. In horses, there is a bacterium that is very important in causing pneumonia in foals, and this is Rhodococcus equi. This is an agent that's found in the soil, and it's very persistent, meaning that in farms that have been infected once will more than likely be affected again in the next foaling crop. It causes pneumonia, and it classically forms this pattern shown on the right, which is a focal pneumonia that originates around a bronchus. And I can't show you the bronchus in this particular focus, but it doesn't affect all of the lung equally. So you may see a nodule here, a nodule there, but not this anterior ventral pattern that we saw in the shipping disease and the bovine respiratory disease complex. This tends to be more of a discrete nodule within the lung, and they can be multiple. This bacterium causes inflammation of the lymph nodes and of the colon, and it's thought that there are really two portals of entry of this organism, either through inhalation. Dusty environment would make the animals prone to developing this bronchopneumonia, or they can develop it through the intestinal tract. The organism will infect the intestine and then disseminate to the lymph nodes that drain the intestine, and then finally transport from those lymph nodes to the lungs. Streptococcus equi is another example of a bacterial agent that can cause pneumonia in horses. We know this agent most commonly is causing strangles in horses. That would be inflammation of the submandibular lymph nodes of the horse, particularly young horses that are housed in a stable environment within stables. But it can also disseminate down into the lungs, causing a pneumonia. In pigs, there are several agents, bacterial agents, that cause bronchopneumonia. And I think you should be aware of these three, and they are Actinobacillus pleuropneumonia. That was previously called Haemophilus pleuropneumonia, and has since been changed to Actinobacillus. The second is our old favorite Pasteurella multocida, which has also been mentioned in cattle and in dogs, and Mycoplasma pyoneumoniae. We haven't mentioned Mycoplasma yet, but this is an agent that is present in the environment, and it can cause a subclinical pneumonia that is very important commercially in terms of weight gains for pigs. It can cause a failure to thrive, a failure to gain weight, and not necessarily severe respiratory signs. There's one virus that's recently been the focus of a lot of attention in causing interstitial pneumonia in pigs. And this is the agent known as PRRS, or Porcine Reproductive and Respiratory Syndrome. This is now known to be an arterivirus, and it causes late-term abortion in pigs, and also pneumonia in newborn and pre-weaning and slightly post-weaning pigs. So we're talking about an agent that targets pigs between 1 and, say, 8 weeks of age, more or less. This is found to be relatively prevalent in the United States and a very significant cause of economic loss in swine industry. Atrophic rhinitis is a disease that has been around for some time, and it causes severe deformation of the nasal turbinates of pigs. But what the new information, or at least the relatively new information, is that this agent, or this disease, this disease is caused by two bacterial agents. The first is Bordetella bronchoceptica, which was the bacterium that we mentioned before is causing pneumonia in several species. And we know that this bacterium is important in atrophic rhinitis because it initiates or colonizes the second phase of the disease, which is caused by Pasteurella multocida. And Pasteurella multocida is an agent that has the ability to stimulate bone formation and bone loss. So now we can link this agent that can affect the bone formation within the nasal turbinates with the infection that occurs in the respiratory tract in the course of this disease. Now let's move to diseases of the brain and spinal cord. I'll start with equine diseases because currently we are in the midst of a very severe outbreak of West Nile virus, and this is a viral infection of the horse that causes a very severe encephalitis, and it's very difficult to distinguish from some of the other viral encephalitides of horses, and I'd like to discuss in just a few moments how to distinguish these two. There's also an economically important protozoan known as Sarcocystis neurona, which affects horses, causing myelitis, inflammation of the spinal cord, and then the malformation of the cervical vertebrae causing the condition known as wobblers. First, though, I'd like to emphasize rabies. We see rabies with a relatively high incidence in Florida, and we suspect it at a very high incidence, and so we always have to rule this out in animals that are showing the classical neurological signs, and the vast majority of these are negative for rabies, but it's very important to always consider this because of its importance as a public health threat. Rabies is a rhabdovirus. All mammals are susceptible to this virus, and so the ones that show the disease are usually the ones that, because of their behavior, are exposed to it. It causes a lymphocytic encephalitis, and these animals will show either a stupor condition where they'd be depressed and lethargic, or they can be very excited where they are aggressive and attacking. And so any neurological disease in an animal that has particularly been unvaccinated or has been housed in an area that is known to harbor wild animals such as raccoons that harbor this virus are considered to be potentially rabies infected. The hallmark of the histological lesion of this condition is the negra body. The negra body is an inclusion body or a viral accumulation within the cytoplasm of neurons. So when you in practice or on this exam, if someone asks you how to identify whether rabies is causing a disease, the important thing to remember is that the brain must be removed, must be unfixed, that is not fixed in formaldehyde, and sent to an appropriate diagnostic lab who can run a test to look for these negra bodies that are either in the hippocampus, the cerebellum, or the trigeminal ganglion adjacent to the brain. And this is confirmed at a diagnostic laboratory through the process of immunofluorescence. Okay, in the horse, the two viruses that we are most commonly confronted with and trying to distinguish are what is known as triple E, or Eastern equine encephalomyelitis, or West Nile virus. West Nile virus was not a problem really even last year, but this year has emerged in Florida and is a significant problem. Eastern equine encephalitis, or triple E, is caused by an alpha virus. In contrast, West Nile virus is known to be caused by a flavivirus. Both of these viruses are mosquito-borne, And the reason that this is important is because they tend to occur during mosquito outbreaks, such as this time of year and slightly earlier. That would be the late summer and the fall. Both of them cause a mixed meningoencephalitis. They infect the meninges in the brain and the spinal cord, causing a mixed inflammatory infiltrate. And when I say mixed, what I mean is that it's both neutrophils and lymphocytes. The difference that we see in these two viruses is the location of the lesions within the brain and spinal cord. Triple E usually causes a severe inflammation of the cerebrum and the upper spinal cord. That would be, say, to the area of the thoracic spinal cord. West Nile virus, on the other hand, tends to infect the lower areas of the brain, such as the midbrain and the spinal and the brain stem, and then extends all the way down to the very lower levels of the spinal cord in the lumbar or the sacral area. And that's one of the criteria that we use to try to distinguish between these two viruses. Equine protozoal myelitis is an important pathogen of horses, caused by the protozoan Sarcocystis neurona. The possum is an intermediate host for this agent. I'm sorry, it's the definitive host for this agent, and birds are the intermediate host. Horses are what are known as a dead-end host. They are thought to become infected by consuming the fecal material of the possum in their feed, and then they are exposed to these agents, and the agent localizes within the spinal cord and causes a severe myelitis, or inflammation of the spinal cord. And this diagram, this figure shows the presence of a site of inflammation in a cross-section of the spinal cord. It's this dark area, and this is the cross-section of a spinal cord of an infected horse. If we were to look at this histologically, what we would see is a multifocal, lymphocytic, and granulomatous myelitis. So the inflammatory cell that we would see would be a lymphocyte and a macrophage surrounding this site of parasitism. We mentioned canine distemper as causing a pneumonia. It's also important to recognize that canine distemper can also cause encephalomyelitis. And this is usually a lymphocytic pattern of inflammation, and it can be present in young dogs, but it can also be seen in older dogs in a condition known as old dog encephalitis. In addition to the bronchointerstitial pneumonia, these dogs may have thickening of the foot pads. The reason being that this virus localizes in the epithelium of the skin and can cause it to proliferate. And so these dogs, in a very severe form of the disease, would have thick foot pads and thickened the nasal planum, or the tip of the nose, would also be thickened. Diagnostically, really the best tissue that we have to evaluate to determine if a dog is infected with canine distemper virus is the urinary bladder. So if you had to submit one tissue to rule out the infection of canine distemper virus, it would be the urinary bladder, because the pathologist then would be able to look at this tissue and identify the inclusion bodies in the epithelium of the bladder. Staying now with the brain and spinal cord, there's a virus of cats known as feline infectious peritonitis virus, and I'll refer to this as FIP. FIP is a coronavirus. It's often seen in outbreaks in cat or catteries, places where cats are bred. And interestingly, this virus is thought to emerge from the intestinal tract, and the virus is present in the environment, and it undergoes a series of mutations that makes this virus then pathogenic in causing the disease FIP. The disease itself is all based on an immune complex mechanism of disease known as a type 3 hypersensitivity. In other words, the virus stimulates an immune response, and the production of antibodies. These antibodies bind to antigens, and then they are deposited in blood vessels. After being deposited in the blood vessels, they stimulate inflammation through the complement cascade. And this then results in blood vessel injury, resulting in leakage and in hemorrhage. So this disease causes leakage of fluids out of the blood vessels and hemorrhage in certain areas of the body. And I'd like to emphasize the two areas that are most prone to disease in this infection. They cause two forms of the disease known as the dry form, which affects the brain and the intestines and the viscera in the abdomen, and the wet form, which causes a peritoneal and a pleural effusion, so the presence of fluid in these two cavities. This diagram shows the two sites, the two forms of FIP disease, the wet form and the dry form. On the left is an example of the wet form, and in this, as I'm showing with the arrow, this is the peritoneal cavity of a cat that's been opened up to show the inside of the cavity. This red area represents the omentum and the mesentery that is very inflamed, and it's very dark red. And if we had seen this when it was first opened, we would have seen that it was full of fluid. This fluid is straw colored, in other words, it's tan. It is very viscous, in other words, sticky, and it may have some cells in it which would make it clouded. And this is the wet form of feline infectious peritonitis, and it affects the abdomen and the thorax. Then the dry form is one that does not cause this effusion and this inflammation in the two body cavities. This is one that causes usually a brain disease. This is a section of brain. In other words, the brain was removed from a cat that died of this condition and then was cut transversely. And what we see here is this asymmetrical area that I'm pointing out that is deep red. And that area is a site where the blood vessels have been injured and there has been hemorrhage in that site, and that is the classical form, the dry form of FIP. So this cat would show neurological signs, and this cat would have shown a very distended abdomen and a high fever. Cats can also develop protozoal encephalomyelitis. Usually this is caused by Toxoplasma gondii, just as this agent caused pneumonia. And the lesion that we see histologically would be a lymphocytic and granulomatous encephalitis, and this agent also causes tissue destruction or necrosis. It's very hard to distinguish that agent from another one known as Neosporum caninum. They're very closely related agents, yet they're different. Neosporum commonly affects dogs, but it can affect cats. And so these two agents should be considered in cases where a protozoal agent is seen in a spinal cord or a brain inflammation. Just to discuss briefly neoplasia of the brain. In small animals, particularly in dogs, there are two primary tumors that arise in the brain that are relatively common. And those are both of glial origin. So these are the supporting cells of the brain. The astrocytoma is a tumor that originates from the astrocyte, and the oligodendroglioma, which originates from the myelin-producing cells of the brain. They're represented in about equal numbers in dogs. So if you were presented with a case of a brain tumor in a small animal, probably a slightly higher instance of astrocytoma, that would be my first choice, but the second choice would be oligodendroglioma. These have a much higher incidence in dogs that are brachycephalic. These would be dogs with a short head structure, such as a Pekingese dog. They, for some reason, are predisposed to these tumors. In cats, the most common primary brain tumor would be a meningioma. This is a tumor that originates from the meningeal lining of the brain. In both species, and really in all species, one tumor that should always be considered to be occurring in the brain would be a lymphoma or a neoplastic disease of the lymphocyte that has spread to include the central nervous system. In cattle, there's a condition of the central nervous system known as polioencephalomalacia, or polio. And this is an important disease both in feedlot cattle and in cattle that are on pasture. It's known to be caused by a deficiency of vitamin B1, and in the feedlot, this is probably associated simply with the diet, a high concentrate diet that is deficient in thiamine. However, thiamine levels in the feed are only a part of this disease process, because it has recently been shown that a sulfur excess can also contribute to this condition, even when thiamine levels in the diet are relatively normal. So excessive sulfur in the presence of relatively normal thiamine can also result in polioencephalomalacia in cattle. In cattle that are on pasture, another mechanism of thiamine deficiency has been found, and that is the ingestion of plants that produce an enzyme known as a thiaminase. And a thiaminase would break down thiamine in the rumen, and that would reduce the amount of thiamine that was available for maintenance of the brain. And so that would be a second mechanism of polioencephalomalacia in cattle. The lesion that we see is a laminar necrosis, in other words, a necrosis that is almost linear. It follows the curvature of the brain and is present in the gray matter. This is the outermost part of the cerebral cortex. And this laminar necrosis results in thinning because of the loss of tissue. And it's very similar to what we see in lead poisoning, which also causes laminar necrosis of the gray matter. When performing a necropsy to try to rule this out quickly, one method that's often used is to use a ultraviolet light and to shine that light on the brain, the cut surface of the brain, before it is fixed. And if it fluoresces, then that is fairly good evidence that the disease is polioencephalomalacia, and this destruction of the gray matter has resulted in the production of a pigment that fluoresces under UV light. Okay, now let's just compare that to another condition that affects the white matter of the brain, leukoencephalomalacia. This is a disease of horses. And this is caused by the ingestion of a fungal toxin known as humanicin B1. It's caused, or it's produced by the fungus Fusarium, and it's usually present in moldy corn. The lesion in this case is necrosis and edema of the white matter of the brain. So as opposed to the polioencephalomalacia, which targeted the gray matter, leukoencephalomalacia targets the white matter. And grossly, if we were to take the brain and examine it at necropsy, what we would find would be that the white matter was greatly expanded. In other words, prior to its undergoing necrosis, it swells up and it becomes very edematous. So the brain is actually bigger than the normal brain. And when the brain becomes bigger, it's encased within the skull, it must expand somewhere. And what we may see is herniation of the brain out of the foramen magnum. In other words, the brain becomes compressed caudally, and this would cause much of the neurological disease that we would see in this condition. One other aspect of copper metabolism that is important in neurological disease is seen in sheep. And copper deficiency in sheep causes a condition known as swayback, or enzymatic ataxia. Both of these are caused by copper deficiency, and copper is known to be very important in the maintenance of normal myelin structure within the spinal cord. So in copper deficiency, the myelin is broken down, nerve impulses are not sent efficiently, and the animal becomes ataxic or loses control of the limbs. And histologically, a slide would show white matter that was degenerating in both the brain and the spinal cord. I want to discuss bacterial disease that is relatively prevalent in ruminants. We're talking about cattle and small ruminants such as sheep and goats. And this is listeriosis, caused by the agent Listeria monocytogenes. This bacterium tends to cause suppurative or neutrophilic inflammation of the brain, usually in the brain stem. And this is usually the tip-off that we're dealing with listeria infection. The lesions, the abscesses that we see are located in the brain stem and not in the cerebral cortex. And the reason that they locate in the brain stem is because this bacterium is thought to enter the brain by migrating up the cranial nerves from the oral cavity. Usually this bacterium is present in silage, and an animal that consumes this silage and may have a wound of the oral cavity would be more prone to have this bacterium migrate up the trigeminal nerve from the oral cavity up to the brain stem where it attaches to the brain and cause a intense suppurative encephalitis in that area. Bacteria that cause disease of the brain in cattle, one in particular is very important, and that is Haemophilus somnus. This causes the condition known as thromboembolic meningoencephalitis, or TEME, or TEAM as some people describe it. What this bacterium does is it causes an inflammation of the blood vessels. In other words, bacteria form large groups that are transported in the blood to the brain, and they lodge in the brain and cause vasculitis, inflammation of the blood vessel, and then infarction or necrosis of the brain itself. And that lesion is classical for Haemophilus somnus infection. This is a bacterial infection that's usually seen in cattle in the feedlot. One group of infectious diseases that has received a lot of attention lately, and it's very important for the veterinarian to be able to understand these, is the transmissible spongiform encephalopathies. The prototype of these is scrapie. This is an infectious disease of sheep and goats caused by an agent known as a prion, or a prion protein. The reason this has become so important is first it was discovered as a disease of cattle in Europe and other areas of the world, causing the disease known as mad cow disease, or BSE, bovine spongiform encephalopathy. It's very, very closely related to scrapie, and scrapie is present in the United States, but BSE apparently is not. BSE was thought to arise through a series of feeding practices in which infected tissue from sheep was fed to cattle, and then this agent then somehow was able to adapt to cattle and then cause this disease known as mad cow disease. There's a very similar disease in humans known as the Creutzfeldt-Jakob syndrome, or disease in humans. And the fear was that mad cow disease may be linked closely enough with this human disease that there might be a zoonotic potential, and that was why there was a depopulation of these animals in England and the United Kingdom. There's also a disease in in deer and elk that are in the wild and present in the United States known as chronic wasting disease, and this is also caused by a very similar agent, the prion. Now, what makes the prion unique? The answer to that question is it's a very small infectious agent that does not have a nucleic acid. In other words, there is no DNA in this agent. It's an infectious protein, which is a relatively novel concept. This is even more simple than a virus. It has just a protein, and this protein is able to induce disease. The agent is called PRP and then subscript SC for scrapie. The lesion that we see would be in the brain, looking at neurons, would be a severe vacuolation, or the formation of a clear space within a neuron, And this is the really strong evidence that we're dealing with a prion as a cause of neurological disease in an animal. A neurological disease of goats that is very important in the United States is caprine arthritis encephalitis virus, or CAEV. This is caused by a retrovirus, and particularly a lentivirus. A lentivirus is a subfamily of the retroviruses. And it causes several diseases that are seen with some frequency. Lymphocytic encephalitis, demyelination of the brain and spinal cord, and necrosis of the white matter. But also it causes mastitis, pneumonia, and arthritis. So these goats are very ill through multiple systems that are targeted by this virus. It's transmitted through the milk, so the reduction of this virus and the control of it is through foster nursing to remove it and eliminate this agent from a herd. Moving now to the alimentary tract, I want to discuss some very important parasites of cattle. The first of them is Haemonchus contortus. This is a nematode, also known as the barber pole worm because of its appearance grossly, that causes severe hemorrhage and erosion in the abomasum. So this causes blood loss in the intestinal tract. And then another nematode of cattle, of the abomasum, Ostratagia. This causes not a blood loss, but a protein loss. So it's important to be able to distinguish between this agent in cattle that causes blood loss, Haemonchus, and the one that causes only protein loss, or Ostratagia. This is not to say that one is more severe or more important than the other. It's just that if you see an animal that's anemic, that's probably more likely to be caused by Haemonchus. And if you see an animal that is hypoproteinemic, in other words, is developing edema or swelling underneath the jaw and the dewlap or in the abdomen, that's probably due to Ostratagia infection. And this diagram, or this photograph, shows the appearance of the mucosa of a cow that was infected with Ostratagii. And these folds that are present on the mucosa are very prominent, much more prominent than they would be in a normal animal. And that's the lesion that's seen with Ostratagia infection. Enteritis in swine is caused by several bacterial agents, and it's important to know some of these. And I'll describe a few of them in the next few slides. The first is swine dysentery. This is an infection that affects the large intestine. It's caused by the agent Brachyspira hyodysentery. You may have learned this as Treponema hyodysentery or Serpulina hyodysentery. So this has changed names 3 times in the last 10 years. The current term is Brachyspira hyodysentery. It causes colitis in weanling pigs between 8 and 14 weeks of age. Another cause of enteritis in pigs is enterotoxemia. Affects the small intestine. It's caused by Clostridium perfringens type C. The key here is it's very hemorrhagic. Causes severe hemorrhagic exudate or pure hemorrhage into the lumen of the intestine, and that is an indicator that this is Clostridium. This is usually seen in newborn pigs, those that are even less than 24 hours old. And then an agent that causes proliferation of the intestine, known as a disease known as proliferative enteritis. It's seen mostly in the ileum. And the agent that causes this is known as Lawsonia intracellulaire. Again, this is an agent that has changed names in the past 5 to 6 years. It used to be known as Campylobacter. Now it's been classified as Lawsonia intracellulaire. It affects older pigs, those that are post-weaning, greater than 4 weeks of age, and it causes a marked folding of the intestine or proliferation. A viral cause of enteritis in swine is transmissible gastroenteritis, or TGE, caused by a coronavirus. It affects young pigs less than 10 days old, and this virus targets the epithelium that lines the villi of the small intestine, reduces their height, and therefore reduces the absorptive capacity of the intestine, and the animal becomes dehydrated and very reduced in nutritional status. An important cause of enteritis in cattle is the disease, Johne's disease. It's also known as paratuberculosis. It's caused by the bacterium, Mycobacterium paratuberculosis, and it affects adult cattle, causing severe diarrhea and loss of protein from the body. Histologically, it has a very classical lesion, and that is granulomatous enterocolitis. That means that there is abundance of macrophages present in the intestine, and these organisms are all filled with microorganisms or bacteria that are acid-fast. So that acid-fast feature is what makes this compatible with a Mycobacterium infection. So it's very similar to tuberculosis in cattle that may cause pulmonary disease, except this is a disease caused by Mycobacterium of the intestinal tract. And this photograph shows a cow's intestine that was affected by Johne's disease. The lymph node is present at the top, and then this is the intestine, the ileum, that has been opened, and so we're looking at the mucosal surface of the ileum. This corrugated appearance, or this thickened, folded, highly folded appearance, is classical for Johne's disease, caused by Mycobacterium paratuberculosis. Enteritis in cattle has several causes. The most notable probably is bovine virus diarrhea virus, or BVD. The condition is known as BVD, and the agent is known as BVD virus. It causes diarrhea and fever. It usually affects animals that are young and can cause ulcers and erosions in the oral cavity and the intestinal tract. Really, the entire gastrointestinal tract can be affected. The esophagus, the abomasum, omasum, reticulum, small intestine, and large intestine. And this is just the tip of the iceberg on what this agent can cause. In other words, not just intestinal disease, it can also cause malformation of the central nervous system, particularly if the animal is infected during fetal development. It also causes very severe necrosis of the lymphoid tissues, and this causes immunosuppression. So BVD can cause or predispose or set the animal up for many other infectious diseases, when really a BVD is the underlying cause. So it's very important in the management of cattle. Salmonella, or the condition being salmonellosis, is caused by Salmonella species, usually referred to as Salmonella enteritis. Affects cattle, pigs, horses, and really many, many other species. And it targets the intestine, where it causes a fibrinous necrosis, or a fibrinous ulcerative enterocolitis. And I'm circling an area of the small intestine that has been affected by Salmonella. Notice how it appears raised. It is lighter colored than the surrounding area, and the reason that it's oval is because it's overlying the lymphoid tissue of the intestine, also known as the Peyer's patch. And this site of the intestine is particularly prone to Salmonella infection. In horses that have Salmonella infection, we need to distinguish it from another infectious cause of enterocolitis, and that is Potomac horse fever. This is caused by an Ehrlichia agent, or rickettsial agent, Ehrlichia rhistosii. It causes a very acute colitis. The animals become very sick. They develop founder quickly. And our top differential diagnosis for this would be Salmonella infection. We can separate these, both Salmonella and Potomac horse fever, based on the histological appearance of the tissue, of the intestinal tissue. With Potomac horse fever, the enterocytes, or the cells that line the intestine, contain bacteria, I'm sorry, not bacteria, rickettsial agents that can be stained with a silver stain. So if we see these organisms in the enterocytes lining the intestine and they stain with what's known as a silver stain, then we can feel confident that colitis has been caused by this agent and not by salmonella. Both dogs and cats develop enteritis due to a parvovirus. And we're probably most familiar with canine parvovirus, a very common cause of enteritis in dogs. And the agent in that case is canine parvovirus type 2. In cats, a similar virus known as simply feline parvovirus also causes enterocolitis, or enteritis, which means that it focuses on the small intestine. And the classical lesion that's seen histologically would be necrosis of the crypt epithelium. So if you recall, we talked about coronavirus and rotavirus, which target the surface of the intestinal villus. This virus targets the lower, or the crypt epithelium, the deeper epithelium that lines the villus. And it also targets cells that are dividing very rapidly, such as bone marrow cells or lymphocytes. So it can cause anemia because of the marrow effect, and also can cause immunosuppression due to the lymphoid effect. And this figure shows the appearance of the intestinal tract of a dog with canine parvoviral enteritis. And the arrow is in the lumen of the intestine. It's been opened up, and so it's been folded so you can see multiple cross sections of the intestine. And the classical appearance of this is a very deep red enteritis. In other words, there's a lot of hemorrhage associated with this virus. I want to move now to disorders that affect the spleen. And this would be, remember that the spleen is both a circulatory organ as well as a lymphoid organ. It stores blood, it clears the blood of infectious agents, and it also is a site where the immune system can respond to an antigen. Different reasons are present for splenic enlargement. If the spleen is congested, when it's removed from the body and it's cut, blood is released, and that tells us that it's congested. It can be caused by hemolysis, because if the blood cells are lysing, the spleen is faced with the challenge of clearing these lysed red blood cells from the circulation, and therefore it expands due to the clearance mechanism. But also an infectious agent, anthrax, caused by Bacillus anthracis, produces a toxin that causes vascular leakage. And this vascular leakage then would allow blood to accumulate in the spleen and cause it to become very congested. When we euthanize an animal with barbiturates, it causes severe splenic enlargement, and that should always be distinguished from these other causes. And then if the other component of the spleen, the lymphoid component, is expanded, that could be due to immune stimulation, or it could be due to tumors or cancers such as lymphosarcoma. One agent that causes lysis of red blood cells that we see in this subtropical environment is anaplasmosis. And the specific agent that I'm referring to is Anaplasma marginale. And this is the organism that's present on a blood smear. It's this dark dot on the periphery of the red blood cell. It targets that cell for clearance in the spleen. And so if we look at this spleen from an animal that has anaplasmosis and compare it to a normal spleen, what we see is this spleen is larger and is also deeper red. It has more blood in it due to the clearance mechanism of these injured red blood cells. Anthrax causes a very similar appearance of the spleen. This is the spleen in the center of the picture. And if you were able to see this, it would be very enlarged, and when it was cut, it would release a very large quantity of blood. And over on this side, a person's hand holding a vial that contains a fluid that was present in the intestinal tract. The reason that this is here is because this disease causes hemorrhage throughout the body. The intestinal tract, the respiratory tract, the mucous membranes all show evidence of hemorrhage. Spleen is enlarged. And if you're ever confronted with usually cattle that are dead at a pasture and you don't know the cause, and it was a sudden death, and you see this release of blood from the intestinal tract, perhaps around the anus, then you need to be very cautious about opening this animal up because it could be anthrax. And of course, as we know, this is a zoonotic pathogen. And then the spleen can be enlarged for another reason. It can be enlarged because the lymphoid component is increased in volume. This is a spleen from a dog with lymphosarcoma. And you know it's lymphosarcoma because if you were able to cut this and look at the cut surface, there would be no blood in there. It's all solid. And that gives it this term, the meaty enlargement or the firm enlargement. And so that would be another reason that the spleen could be enlarged. In cattle, lymphosarcoma is caused by a virus, bovine leukemia virus. This is a retrovirus, and there is a specific pattern that we see with lymphosarcoma in cattle infected with bovine leukemia virus. It targets several specific tissues, including the abomasum, the right atrium of the heart, the urogenital tract and kidneys, lymph nodes, and some other tissues. And I'd just like to show you some examples. This is a lymph node from a cow that has lymphosarcoma, and this is from a normal cow, a lymph node from a normal cow. And the difference is the lymph node is enlarged, and it lacks the typical structure that we should see in a lymph node. And this normal node, this dark area, represents the cortex of the node, which is normal, and that's completely absent from this node that is affected by lymphosarcoma. In addition to the lymph nodes, the abomasum becomes infiltrated by the neoplastic cells, and it causes the leaves of the abomasum to become very, very thickened. It can result in protein loss into the intestinal tract and severe weight loss. The kidney can also become infiltrated, and this the arrow is outlining the area of the kidney that contains the tumor. It's this pale, tan, homogeneous tissue, which is lymphosarcoma. And then in the heart, in cattle, lymphosarcoma will target the myocardium, and this arrow is outlining this white area in the heart that is lymphosarcoma as well. So I think it's important for exam purposes and also for practice purposes to know the common sites of lymphosarcoma in cattle. Now let me briefly discuss the endocrine system and some disorders of the endocrine system that are probably the most important to know. First, consider these facts about the endocrine system, and that is that it is composed of a series of circuits where you have a circuit that senses a metabolic abnormality, such as calcium levels or glucocorticoid or steroid levels in the blood. You have the release of a factor, in this case from the hypothalamus, called a releasing factor, which stimulates the pituitary gland, the anterior pituitary gland, and that releases a trophic factor, which enters the blood and goes to a target tissue. So there are multiple tissues involved in this cascade effect of the endocrine system. And let me show you an example of that. That would be a functional chromophobe adenoma of the pituitary gland in the dog. Okay. In this condition, which is one of the most common causes of Cushing's disease in dogs, or hyperadrenal corticism, we see that a tumor that is located in the pituitary gland stimulates the adrenal cortex through the production of ACTH, ACTH being adrenal corticotropic hormone. So the tumor of the pituitary gland stimulates the adrenal cortex to become enlarged, and the lesion that we would see histologically would be hyperplasia of the adrenal cortex on both the right and left sides. That then results in the release of cortisol from the adrenal cortex, and that causes the disease known as Cushing's syndrome, the excessive release of cortisol from the adrenal cortex. Results in a syndrome of hair loss, liver enlargement, increased abdominal fat, and decreased muscle mass throughout the body. And this is a photograph showing a functional pituitary adenoma causing Cushing's disease in a dog. This is the skull of a dog that has been opened and the brain has been removed, and I'm drawing a circle around the pituitary gland. Notice how large it is and how it expands toward the screen. That is because it is producing large quantities of the hormone adrenal corticotropic hormone, or ACTH, stimulating on both the right and the left sides the adrenal cortex to become hypertrophied or enlarged. And the product of this would be cortisol. And so these dogs suffer a condition where they have an excessive amount of cortisol due to this tumor in the pituitary gland. Now I want to contrast that to a condition in horses known as a non-functional adenoma of the pituitary gland. Non-functional means that the tumor itself does not secrete a hormone. And it causes disease not by inducing the release of a hormone, but by compressing the surrounding area of the brain. And in horses, the clinical syndrome is due to the diseased or the neoplastic pituitary gland compressing upward on the hypothalamus. And the hypothalamus is very important in the control of thirst, appetite, and temperature. So horses with this condition develop hirsutism, or an abnormally long hair coat. They develop an elevated body temperature, polydipsia, polyuria, and excessive appetite. All of these are attributable to the tumor expanding up and compressing the hypothalamus of the brain. So comparing this with the condition in the dog, the tumor in the horse causes disease by compression. The tumor that was present in the dog caused disease by stimulating the release of ACTH, which then went to the adrenal glands and stimulated the release of cortisol and caused Cushing's disease. This diagram shows the tumor present in the pituitary gland of a horse that was causing compression of the hypothalamus. And if we cut this and turned it over, what we would see is this large area of hemorrhage and necrosis where that tumor had expanded up and caused compression of the brain. And that's the classical appearance of this condition in horses. Some other endocrine diseases of note would be hyperplasia of the thyroid gland in the cat. This causes hyperactivity and increased appetite in cats due to sometimes bilateral but often unilateral hyperplasia of the thyroid gland. And ferrets have an extremely high incidence of tumors of the adrenal cortex. They can be either benign or malignant, so they could be either an adenoma or a carcinoma. And then horses also develop a condition known as nutritional hyperparathyroidism. This is a disease where a horse has eaten a diet that is high in phosphorus. That gives it the name Brand disease, or Brand diet is very high in phosphorus and very low in calcium. And this high phosphorus diet stimulates the parathyroid glands to go into action and to try to reduce phosphorus by increasing calcium. The result is this condition known as Brand disease, or big head, where a horse will develop very marked swelling of the bones of the face. And this picture on the right shows a very marked increase in the thickness of the maxilla around these molars because calcium is being mobilized from the bone in an attempt to correct for the excess of phosphorus in the diet. And the key here is that phosphorus and calcium are always trying to be maintained in a balance. If there's a high high phosphorus, then the body tries to compensate by elevating the calcium. And to do that, it must mobilize it from the bone, therefore causing this lesion in the bones. I want to mention a disease of the bones that is very important because it affects almost every animal species, and that is osteochondrosis. Osteochondrosis is a disorder of endochondral ossification, and it causes necrosis of cartilage. And this cartilage is important both on the epiphysis, or the articular ends of the bone, as well as at the growth plate. And if this piece of cartilage dies and separates from the articular cartilage, it causes the condition osteochondritis dissecans. The problem with this is it has multiple etiologies. It's probably partly inherited, it's partly attributable to diet, and it could be also affected by management, excessive weight gain, or to try to enhance the growth rate of an animal may predispose to this condition. This shows a osteochondrosis, or an OCD lesion, of the articular facet of the vertebra. And it's this white area present on the articular face of this joint that could potentially become detached and then cause severe arthritis. And this radiograph shows the separation of this area of bone from the rest of the articular facet. Some common sites for osteochondrosis in other animals. In dogs, it's very common in the humeral head, and this is seen in large breed dogs that are rapidly growing and causes lameness in the shoulder region. Horses, in addition to the articular facets that I just showed, the distal tibia is a common site for these areas of cartilage interruption and injury. And then the pigs, medial condyles of the distal femur are common sites for the development of these changes. Interestingly, cats don't develop this condition at all. Maybe it's because they're less predisposed genetically, maybe because we don't try to make them grow at an extremely rapid rate. Well, that concludes my review of anatomic pathology, and I wish you the best on this exam, and I look forward to our discussion video conference later. Thank you.